Hi, I'm Annelise. I'm 13 years old and live in Bismarck, North Dakota. When I was 6, I was diagnosed with a chronic disease called type 1 diabetes. This is a condition in which my pancreas no longer produces insulin. I now have to inject it manually through my insulin pump. I also have to constantly monitor my blood sugar, how many carbohydrates I eat, know how much insulin to give as well as when to give it or when not to give it, know the different ratios to keep my blood sugar stable, as well as a million more things on top of being a normal 13-year-old. I could talk for hours about my story, what I've learned, my hardships, what to do, but I don't have hours and I have to get an important message across. So, the Department of Justice has decided that it will not defend critical healthcare protections. This means that insurance companies can charge more to families, individuals, and children with pre-existing conditions, as well as the elders and the sick who need coverage. Now let me tell you a little bit more about the finances of those who would be affected, like diabetics like me. We have tons of supplies we need: insulin, meters, strips, shots, pump, and just alone insulin is in the top 10 most expensive liquids in the world, and strips, which we use about 5 of a day, cost $1 per strip, and so that's $5 a day, and it eventually leads up to $1,825 a year just for this, and we have tons of supplies. So if type 1 diabetics aren't able to get health insurance, we'd have to pay between $10,000 and $30,000 a year. Think of what you could do with all that money. You could go on a nice long trip, pay for a year's worth of college, buy a new car, or you could pay for a year's worth of medical supplies and doctor visits. Most others with pre-existing conditions have expenses like this as well, and at least being a type 1 diabetic, I can work, I can be independent, walk and talk on my own. Others don't have that kind of luxury. And do you think that those with pre-existing conditions like me have tens of thousands of dollars lying around to pay for a condition we didn't get a say in getting? So here's our problem. If the Congress allows the DOJ to not defend the Affordable Care Act and represent those with pre-existing conditions, we'd lose everything. People would go bankrupt. They couldn't buy the medical supplies they needed, as well as basic human necessities. Yes, some are fortunate enough to have secure health insurance, but others are not. Alone in North Dakota, there are 300,000 of us with pre-existing conditions, and in the U.S., there's 130 million. That's 1/3 of the U.S. population. Who knows how many would lose everything? As Americans, we are promised by the government to be treated equally and given equal opportunities, not to be discriminated. We've done a poor job of that, and if I have a say in this, I will not let one more thing be added to that list. I speak on behalf of others with pre-existing conditions and those who would be affected when I say that the Congress should oppose the action to eliminate the critical healthcare protections and fight against it.